When a man is not able to conceive a baby with his female partner, it is usually a sign of infertility. A study conducted by Weill Cornell showed that 15 to 20% of American couples who are trying for kids are not able to do it exactly due to infertility. In 50% of those cases, male infertility is the reason. According to statistics, over 2.5 million men in the United States are affected by infertility, which is just over 1% of the entire population. Most men are not sure what to do about it or where to get help. However, what they can do is reach out to a medical professional if they suspect infertility might be an issue for them. So, what causes male infertility? Some of the most common causes include low sperm production and how the sperm travels. Research shows that about 2/3 of infertile men either have a low sperm count or their sperm doesn't work properly. 1 in 5 infertile men usually have other physical problems, such as obstructions in the tubes that prevent sperm from moving freely. Other physical problems can include vasectomy and men who have decided to have children after the operation. Some of the less common causes of male infertility include low hormone levels made in the pituitary gland. 1 in 100 infertile men is affected by this. Others struggle with sperm antibodies, which are basically proteins that fight against sperm and reduce fertility. Infertility can also be genetic. Some of the most common causes of genetic infertility include chromosomal conditions that affect sperm production. These include Klinefelter syndrome, which is a condition where men are born with an extra X chromosome, deletion of the Y chromosome, which is a condition where genetic material missing from the Y chromosome plays a significant role in sperm production, and there are also other genetic problems, such as Down syndrome. Additionally, infertility can happen because of changes in DNA. However, this is far less common. What should you do if you're worried about your fertility? Medical experts suggest that couples who can't conceive for over a year visit their doctor or a family planning clinic. Sometimes both partners have issues, and it's always smart that both of them do tests at the same time. When you do visit a medical professional, they will do a thorough physical examination and an analysis of semen. During the semen analysis, they will check the number, shape, and movement of sperm. Other tests such as hormones to detect sperm production or genetic testing may be done. Sometimes you may even be asked to do a testicular biopsy, ultrasound, or MRI. But can you treat infertility? Couples can conceive naturally after treatments, but only 1 in 8 infertile men have a treatable condition. In other cases, doctors may recommend assisted reproductive treatment, such as insemination or in vitro fertilization, also known as IVF. However, assisted reproductive treatments can't cure or treat the cause of infertility, but they can help couples conceive. As far as genetic infertility is concerned, there are no known treatments. Can anything be done to prevent male infertility? Research has shown that several things can harm the production of sperm, so medical experts advise that you avoid drinking alcohol in excess, smoking cigarettes, catching STIs, drinking water from plastic bottles, and avoid heat stress from tight underwear. They also suggest a healthy and balanced diet. For men who work in places that may affect their fertility, they must wear protective clothing and follow health and safety guidelines required by their occupation. Medical experts also recommend that couples who are trying to conceive stay away from any harmful chemicals. What can you do to cope with infertility? Unfortunately, many people believe that infertility is a woman's problem, which is not correct. Men can be infertile as well. That's why most men are usually unprepared when they are told the news, which can be a shocking and upsetting experience. Fertility problems in men can lead to mental health issues, affect their potency, masculinity, and sexuality. However, having an emotional reaction is completely normal, and reaching out to a counselor or therapist is advised. Men are also advised to turn to their partners, friends, and family for support. Male infertility is an ever-increasing problem that is not talked about enough because most men fall prey to the false idea that they should be tough and not talk about issues. So, if you are facing a similar problem, make sure you reach out to a medical specialist right away.